Hello, hello. My name is Jones, and today we are going to look at infection prevention, and also we are going to look at common post-operative complications. So today we are looking at infection prevention, that is in relation to surgery, and also we are going to look at common post-operative complications. Okay, so we are looking at a series of topics, okay, that feature in the foundation of understanding surgery and surgical nursing. So, in the first three videos, we looked at perioperative care. Now, we want to also establish infection prevention, the general measures that can be used for infection prevention in surgical scenarios. And also, we are going to look at the post operative complications that are common. Okay, post-operative complication will depend on the condition, and then there will be specific complication that will come because of that condition. But for all surgery or all major surgery, there are always some general complications that can arise. So, infection prevention is a universal application of standard precaution in order to have minimum level of infection, or it is a standard precaution that provides minimum level of infection control required in the treatment and care of all patients to prevent transmission of bloodborne viruses. So, for doing procedures in surgery, you need to have a universal application of this standard precaution of preventing this infection, as patient is at risk of getting infection from the surgery that they are about to undergo. Infection prevention is going to ensure that a high level of protection against transmission of infectious microorganisms, including bloodborne viruses in the healthcare setting, and other recommended care and treatment for all patients in the handling of blood, including dried blood and other body substances, secretions and excretions. Okay, so it includes all things like urine and stool. So you have to prevent infection because these may harbor microorganisms that may introduce infection within the patient. So you can also achieve infection prevention by carrying out activities like hand washing. Okay, hand washing is generally considered the most important hygiene measure in preventing spread of infection. You can also prevent infection, okay, through hand washing if everybody washes their hands before and after significant contact with any patient and after activities that may cause contamination. And activities that may cause contamination may include, let's say, before and after each clinical procedure. So when one or health staff is conducting a clinical procedures, they are using their hands, coming in contact with the patient, viruses or bacteria may be introduced on their hands or the surface part that has been exposed to the patient. So this can be a source of infection to the other. So that is why it is important to hand wash. So contact with infection also can come, that is before and after eating, after using the toilet. So after using the toilet, you can come in contact with some infection. So it is important that you wash your hands after using the toilet. It's important that before you eat, you wash your hands. Okay, after you eat, you wash your hands. Before and after using gloves, you need to wash hands. After contact with used equipment, you need to wash hands. Immediately following contact with body substances also requires that you wash hands. Other equipments that are used for prevention of infection include the protective equipment known as gloves. Okay, we have what we call PPE, personal protective equipment. So gloves fall under infection prevention tools. So gloves are a form of personal protective equipment, and clinicians and other healthcare workers should wear gloves whenever there is risk of exposure to blood or body substances, and should change their gloves and wash their hands after contact with each patient and during a procedure with the same patient if there is chance of cross infection. So gloves must be used when handling bloods or body substances, performing vein puncture, touching mucous membranes, touching non intact skin, handling contaminated shops, or performing invasive procedures. Gloves can also be worn when cleaning body substances that spill to any of the equipment or materials or surface that may have been contaminated by body fluids or substances. Other protective equipments, include eyewear and face shields. These must be worn during procedures where there is a potential for splashing, splattering, or spraying of blood or other body substances. Impermeable gowns and plastic aprons should be worn to protect clothing and skin from contamination with blood and body substances. Footwear is also part of protective equipment and should be enclosed to protect against injury or contact with the sharp objects. Then there are accidents that we call in the hospital needle stick injuries or injuries that may come from needles or other sharps. So, in infection prevention, it's important to avoid needle stick injuries. So, these can be minimized by proper handling of needles and other sharps and also clinical waste. Okay, you need to handle these, okay, and practice a good nursing skills that will not put your life at risk of you pricking yourself. For instance, do not bend or recap needles, okay, because this may increase risk of you pricking yourself. You can use safe needle handling system, including rigid containers for disposal, which should be kept out of reach of toddlers. Okay, then also ensure sharps containers are available at point of use or in close proximity to work at the site or for easy, immediate disposal. When preparing for procedures, okay, so there are procedures that will require that you carry the disposable box for needles or for sharps. Okay, within the hospital, there are color coding for managing of waste. So clinical waste is considered to be very infectious. So you need professionally to adjust to all infection prevention measures. Okay, so with the part of infection prevention discussed, we are now going to look at the general post-operative complications. Okay, it is important for us to talk about infection prevention to do with surgery because infection can also be a source of post operative complications. So, we have this mnemonic GRCM. So, GRCM talks about necessarily systems that may that through which complications may arise. So, that is gastrointestinal system, there are complications that may arise because of surgery. Respiratory system, there are complications that may arise because of surgery. Cardiac system, there or circulatory system, there are complications that may arise. Musculoskeletal system, okay, or integumentary system, there are some complications that may arise within this area. Okay, so the other part of this mnemonic of how you can remember post-operative complication is using the mnemonic SHOCKED. Okay, so S is for sepsis, okay, infection affecting the integumentary system, okay, or infection that may affect the circulatory system. Okay, so when you talk about GIT, there are complications within the GIT. like paralytic areas. Okay, respiratory, there are complications that may come within the respiratory tract. Okay, then cardiac and musculoskeletal. So when talk of hematoma, that is a complication affecting the circulatory system. Even cardiac arrest is one of those complications. So that is foreseen. Then E is evisceration, complication affecting the musculoskeletal system or integumentary system. There is dehiscence, okay, to do with wound complication. It is affecting the integumentary system or musculoskeletal system. Okay, so in our mnemonic, O and K do not necessarily present any complication, but you can still research more. Maybe these can still be assigned certain complications, but otherwise, shocked can be used to understand these complications. Okay, so let us look at more details on these complications and how they may arise. So, wound infection. Okay, as the first one, wound infection or sepsis. Sepsis is infection that may affect either the blood or the skin. So, sepsis, wound infection as the first one. Wound infection is commonly manifested by fever, increased pulse, that is increased pulse rate, generalized malaise, redness, swelling, and tenderness of wound area. Spontaneous purulent drainage will occur unless if the infection is deep, in which case the surgeon may remove a suture and probe the area to facilitate pus drainage. A pus swab is then taken for culture and sensitivity to determine the causative organism and institute appropriate antibiotic treatment for the infection that has been seen. So this is still generally sepsis or wound infection. An antibiotic or sulfonamide will be prescribed and administered if ordered. This is to systemically deal with the infection that might have arisen. Frequent application of hot moist dressing may be ordered to increase blood supply to the wound area and also promote drainage of exudates. Even if the wound is infected, a strict aseptic wound dressing technique will be used to prevent introduction of secondary infection. When sewed, dressings are removed and they are immediately placed in a plastic bag for disposal. Infections that may happen almost 24 hours after surgery, these will be primary infection, okay, infection not necessarily to do with the surgery, but infection that may happen, for instance, 2 weeks after surgery, this would be secondary infection that may arise from the ward level. So it's important to prevent wound infection through proper guidelines for strict aseptic technique. Precautions should be taken to prevent contamination of beddings and other objects in the environment and prevent transmission of infection to other parts of the patient or the staff. Then in our shocked, we have H for hematoma, we have H for hemorrhage. So H for hematoma formation. Hematoma is a collection of blood usually clotted in tissues under the incision area. So this can come as a complication or as a general complication in surgery. This may impair blood clotting mechanism if at all it happens that the patient has developed a hematoma. Patients receiving anticoagulant therapy of for a period of time preoperatively are more at risk of developing a hematoma. So in this condition, the wound edges are elevated and discolored. So if the swelling interferes with vital function, causing a discomfort, and if impairing healing, the surgeon will evacuate the clot by needle aspiration or reopening the wound. This is usually prevented by leaving drainage tubes in situ after an operation to drain accumulated blood from the incision area. Okay, so the other complication in our shock is a day sense. This is a general complication, especially if you're talking of abdominal surgery, dehiscence, wound dehiscence. So dehiscence is the separation of the edges of the incision caused by excessive strain on a wound. Such occurs in prolonged abdominal distension or severe coughing or wound infection. Okay, wound infection like if one has evisceration. It may also occur if patient has malnutrition or general debilitation. Suturing or application of adhesive strips may be used to pull the edges of the wound together to allow healing. So, to prevent wound dehiscence, you need to ensure that the patient has got the right weight for proper surgery. Patient is not malnourished. Patient is treated from respiratory tract infection that may create abdominal cavity buildup when they are coughing. So, to prevent wound dehiscence, treat respiratory infection. What is wound dehiscence? We are saying a separation of the edges of the incision that is caused by excessive strain on the wound. Then we have evisceration. Evisceration is the separation of all the tissue layers in an abdominal wound and the protrusion of a loop of the intestine onto the surface that may occur as a complication. Evisceration is usually sudden and the patient experiences something giving away and a warm sensation on the skin, okay, surface due to the escape of peritoneal fluid. Okay, for instance, if the patient is coughing, after they cough, trying to support the abdominal area where the operation was done. So after they cough, they feel like there's some fluid that is escaping from the wound area. So evisceration, okay, some viscera or internal organs start to protrude on the incision area because of buildup of pressure within the abdominal cavity. So evisceration, we are looking at the separation of all the tissue layers in an abdominal wound and the protrusion of a loop of the intestine onto the surface. Okay, so if this occurs, that is evisceration, the surgeon must be notified immediately and sterile dressing of normal saline are applied to the exposed intestine. This is to prevent, okay, so dressing of uh, normal saline, okay? So you can use warm normal saline to improve blood flow. Okay, don't have to use something which is cold because it may impair blood circulation to the area. So, normal saline will be applied to the exposed intestine part. If a large portion of the intestine is out or eviscerated, a sterile towel moistened with normal saline will be used to provide better protection. So what we want here is to prevent infection. We want to have good blood supply. So and a binder may be applied for support to prevent further coming out of abdominal organs in evisceration. The patient in this condition is requested to lie um, very still in bed with the someone to remain with the patient to provide reassurance, and the sedative may be ordered to allay anxiety. Induced vomiting or lavage is contraindicated as these may increase intra-abdominal pressure and more intestine may eviscerate. Okay, so away from evisceration, which is part of the GIT complications that we see in abdominal surgery or as a general complication in major abdominal surgery, let us now look at respiratory complications. Risk factors for respiratory complications include advanced age, smoking, acute respiratory infections, marked obesity, chronic obstructive pulmonary disease, thoracic and upper abdominal surgery. Most often are seen hypoventilation, atelectasis, and embolism. But whatever the pulmonary complication that one may suffer from, hypoxia is the common problem under respiratory system. So the most common seen respiratory complication includes atelectasis. Okay, so a lung problem here, that is atelectasis. Then embolism and emboli. Okay, so an emboli, that is air bubble, here affecting breathing. Atelectasis, here there is the lungs that are failing to do air exchange, okay, because of some impairment, tasis. Okay, so the common problem seen, especially in the immediate postoperative care, is hypoxia because of surgery or as a general complication of surgery in the immediate postoperative phase. So it may be manifested by headache, that is hypoxia, and then patient may also have restlessness because of hypoxia, irritability, apathy, dullness, and clouded consciousness. The pulse rate will increase, and arrhythmias may also develop because of hypoxia. Hypoventilation occurs frequently in the immediate postoperative period as a result of respiratory center depression that is caused by drugs or general anesthesia. So we are saying the hypoventilation that we see in the immediate postoperative phase mostly can be attributed to drugs that suppress the respiratory center. Okay, so the drugs, the anesthesia drugs that are given in theater. Atelectasis, which is a total or partial lung collapse, okay, can result from obstruction of bronchial tubes by aspirated material or a plug of mucus. If the collapse area is large, the patient becomes dyspneic and cyanosed. That is in atelectasis, lung collapse. Okay, when there is a lung collapse, patient's respiration becomes rapid. So patient's respiration becomes rapid. Okay, that is, patient is going to have tachypnea, fast breathing, and that is fast and shallow breathing. Then the chest expansion is decreased on the affected side. The temperature and pulse rate will be elevated. Then on examination, there is a dull sound on percussion of the chest, and then absence of sounds, absence of sound, that is the area where there is atelectasis or where there is a lung collapse. The trapped secretions, okay, to harbor organism leading infection like pneumonia and also collapsed the lungs. So the area that has been that is collapsed may harbor some infections. Okay, so because there's less oxygen going to that area, so this then may also lead to infections. Pneumonia, okay, may also develop independently of atelectasis. Any retained secretions in the alveoli and the bronchial tubes readily become infected. The patient usually complains of cough and chest pains. So if the patient after that is postoperatively is in bed for a long time, it reduces lung expansion, leading to stasis of secretions, and those secretions become source of infection. So patient may suffer from pneumostatic pneumonia. So the temperature, pulse, and respiratory rates will also be elevated, and the sputum will become purulent and stained with blood because of stasis of secretions. Pulmonary embolism is also one of the complications that we see within the respiratory tract. So a clot or part of it may break away and flow through the heart into pulmonary circulation until it occludes a pulmonary vessel. So this then causes what we are calling pulmonary embolism. Emboli may alter pulmonary circulation and decrease the function of the right and left side of the heart. Pulmonary embolism is a complication of deep vein thrombosis, and it is a serious postoperative complication that may lead to 30 to 40% of death if patients are not treated. Okay, so respiratory complications can be prevented by recognizing early, even mild respiratory infection and reporting them promptly. Surgery must be arranged if the patient shows any signs of respiratory infection. So surgery must be arranged if patient shows early signs of respiratory infection. So if you do surgery with a patient having respiratory infection, the likelihood of having respiratory complication becomes high. Offering a good nutritious diet, okay, as to prevent respiratory infection is also important as it may contribute to the patient resistance to infection and discourage also patients for those smokers, discourage them from smoking, okay, pre-operatively. This is to prevent any of these respiratory tract complications that we see in major surgeries. Okay, ensure patient stomach is empty before anesthesia. Administration to reduce the danger of aspiration or vomiting here is quite important because we want to prevent aspiration pneumonia. Patients after surgery may feel nausea and vomiting, and if they vomit a lot, they may aspirate this and it may lead to aspiration pneumonia. The patient should be positioned in lateral or semi-prone position as you collect them from theater. This is to prevent obstruction of airway. This is to promote drainage. Okay, as patients coming from a theater or as you lie, make them lie in the immediate post-operative care. And of course, promote it will promote drainage as we have mentioned, and also deep breathing exercises are some of the exercises that you can encourage the patient to do post-operatively. Okay, deep breathing will improve oxygen that is going to the tissues as the patient covers post-operatively. Okay, so with that, then we can now look at other complications that we see postoperatively. Okay, so there are other complications that we see postoperatively that we need to appreciate. Coughing and is one of those complications that we see, and we need to prevent coughing postoperatively. Okay, early ambulation is important as it will assist prevention of chest infections. Okay, so coughing and change of position also assist in the prevention of pulmonary complications. And then we have said that early ambulation, okay, improves lung expansion. Okay, so the application that we can look at to the circulatory system or the cardiovascular system here is hemorrhage. Okay, hemorrhage, that bleeding may occur as out of a slip of a ligature during after surgery, or it may also be due to an increase in blood pressure, opening up previously collapsing blood vessels, or due to dislodging of a clot that had plugged a blood vessel. Patients with hypertension, okay, we do not conduct surgery because of the risk of buildup of pressure. Patients with a clotting problem or clotting disease, clotting mechanism disease, okay, or disease that may affect clotting mechanism, we do not do procedure until we reach some normal levels of function. So the bleeding may be seen at the site of operation or may be concealed. Okay, when I say may be concealed, that is not seen. So internally, it is concealed, so you cannot see or it's not manifesting. So you need to monitor vitals and any changes in vitals here. Okay, you need to know which ones going to show that there might be internal bleeding. So that is a feeble pulse. Okay, will be a sign of internal bleeding. Loss of that causes a fall in blood pressure. So a rapid 3D pulse and a deep rapid expression is one of those that are seen. Okay, and then patient may also show some power and apprehension or restlessness because of internal bleeding. So dressings should be checked frequently on the site of operation for signs of bleeding and the body area checked for swelling or distension. If the patient is bleeding, then reinforce the dressing, or sometimes he may be taken back to theater for ligation of bleeding vessels. So this is in effort to prevent hemorrhage. So the other complication that is within the cardiovascular system is hypotension. Okay, there's hemorrhage and there's also hypotension. Hypotension, where we're looking at low blood pressure than normal, that may result in sudden changes in position in the immediate postoperative period. To avoid this complication, a change in position of the patient should be made slowly and the patient's response monitored. Resistant or prolonged hypotension postoperatively should be reported to the surgeon. Okay, so with that said, then we can look at also the other major complication that we see postoperatively, which is shock. Shock may develop during or immediately following surgery, or may develop slowly and become evident several hours after operation. It may be secondary to severe infection, that is, patient is having bathymic shock, or respiratory complications that may occur. Early signs of shock include decrease in blood pressure, restlessness, pallor, okay, cold and clammy skin, rapid and weak pulse, and also cyanosis. These are some of the early signs of shock. Shock is a serious complication and a life-threatening condition, and as such, prompt recognition and action are necessary to prevent the condition from occurring or becoming irreversible. Okay, then the other complications for our shocked pneumonic D is deep vein thrombosis. Okay, there's deep vein thrombosis and thrombophlebitis. Deep vein thrombosis is the formation of a clot in a vein due to stasis of blood and the development of it is mostly in the lower limbs. The pressure on the calf and the prolonged flexion of the legs should thus be avoided in order to prevent thrombosis, as they may slow blood circulation. Although a patient may find a pillow under his knee, okay, this is dangerous as it may promote venous stasis. Frequent foot and leg exercises may play an important role in the prevention of deep vein thrombosis in patients confined in bed. Thrombus formation is a silent process. There may be some tenderness in the calves of the legs that is accidentally discovered by pressure or felt on stretching the calf muscle. There are no evident signs and symptoms in this condition. Okay, so in this condition, an anticoagulant will be prescribed to prevent formation of a large thrombus. Okay, so thrombus formation or deep vein thrombosis is a very dangerous condition because the clots may be carried along the bloodstream and may eventually block a blood vessel, causing embolism, which is quite fatal. Okay, so from embolism or deep vein thrombosis and phlebitis as a complication, then the other cardiovascular complication that we can look at is cardiac arrhythmias. So this complication may occur due to anesthetic agent or may occur secondarily due to surgery of the heart. Ventricular arrhythmias may lead to cardiac arrest, and these require continuous monitoring and immediate intervention. So, cardiac arrhythmia, because of anesthesia, is one of those complications that may arise in general postoperative complications. Okay, so cardiac arrest from cardiac arrhythmia, also cardiac arrest is also one of those complications affecting the cardiovascular system. Cardiac arrest is a rare complication but requires emergency treatment. It may also occur due to anesthetic agents or operation involving the heart. The most the post-operative patient should thus be closely monitored soon after a major operation, and especially in surgeries where general anesthesia has been used. A cardiac arrest trolley and emergency drugs should always be kept available in the recovery room of the patient post-operatively. Okay, so with cardiac arrhythmia and cardiac arrest as cardiovascular complications are discussed, then we can now look at a GIT complication, which is paralytic areas. Okay, paralytic areas, we are looking at the decrease or absence of peristalsis that may occur following an operation. The bowel is normally in constant motion, digesting food and absorbing nutrients. The steering bowel, even by the surgeon's touch, okay, can cause the motion to come to a standstill. Fluid and gas may then cause the bowel to swell or distend. A nasogastric tube is passed through the nose, that is through the nose and into the stomach to relieve the distension. When bowel function return to normal, okay, the tube is then removed. That is for a patient that might have suffered from paralytic areas. So that is how you can manage it. Until that time, food and liquids are not permitted by mouth, and hydration is maintained using intravenous ways. Okay, so Uh, so with plastic areas, we can say this is the last complication. And the other way you can prevent areas is a knee by mouth for after a major surgery for 2 to 3 days. Okay, this is because you want to promote gastric emptying. Okay, so there you have it. Today we have been looking at infection prevention in surgery. We have talked about the different points that we need to appreciate. Okay, in the infection prevention that is postoperatively. Okay, so in looking at general postoperative complications, we have looked at complications that may affect the gastrointestinal system, where we've mentioned paralytic areas. Okay, we have talked about complication affecting the respiratory system. Okay, so that is affecting the respiratory system. We have talked about complication affecting the cardiovascular system. We have talked about complication affecting the musculoskeletal system. And then the same mnemonic can also be looked in terms of the way that shocked to that is for the specific complications may arise postoperatively. So the specific complication arising postoperatively includes sepsis, which is infection of the wound, or infection arising post-surgery. Then H is hemorrhage, H hematoma, okay, as the complications that may arise post-surgery. C is for cardiac arrest. Okay, C is also for cardiac arrhythmias that may be because of drugs that are used or surgery on the heart. Then evisceration is also one of those complications, then dehiscence. So those are some of the things that we discussed and expanded, okay, expanded our discussion in looking at the complications of surgery. So these are general complications for patients that may undergo general surgery. Okay, so these are the complications, okay, and then the shock, these are the complications. And then it was important that we talk about infection prevention because when you're working in a surgical unit, you have to maintain asepsis at all times. That's why scrubbing, there is seriousness in infection prevention when you're working in a surgical unit because broken skin becomes compromised in fighting infections that may come outside. So you have to prevent infections at all cost in surgery. So from me, I'm saying continue studying and keep on pushing. Thank you very much.